Ladies and gentlemen, this is our Day of the Dead special with Mr. Mayfield, and we'll talk about the Haemophilus decree and Shankrite. And only for you, we have two witnesses of Shankrite related to Haemophilus decree who were a part of a study that was carried out at the Chicago Intensive Treatment Center. But before spending time with the guests, what is Shankrite? Shankrite is a highly contagious sexually transmitted infection. It occurs when the bacterium Haemophilus decree infects the body. As we notice, let's start with our first witness of Shankrite. Please welcome Miss Jasmine. Please tell us how your experience was at the study. How did this impact in your life? Which were your symptoms? And how did they confirm that your infection was related to Haemophilus decree and not with syphilis? And please tell us if you can still remember what was the treatment after they found out the true origin of your infection.
Hi, it's nice to be here with you. In my case, I start with a small but very painful sore, something I had never experienced before. I thought maybe it was irritation or an allergy, but after a few days, it got bigger and began to separate. I also noticed a painful lump in my groin area. That's when I decided to go to the Chicago Center. At first, they weren't sure what it was because the source looked similar to other infections. They did some blood tests and took a sample from the lesion. A few days later, the result came back positive for Haemophilus decree, which causes chancroid. It was really hard for me because when I was told about a tentative chancroidal infection, honestly, I was scared and embarrassed. I had never even heard of that disease before. I think my treatment was really simple because I was just given 46 grams for 6 hours of sulfathiazole within 10 days. But I present adverse reactions, so the doctor recommended penicillin, but I'm present resistance. So my new treatment was with doxycycline every 12 hours for 7 days. Fortunately, I recovered, but I've heard that you can have relapse. It's true, and using a condom doesn't completely protect against chancroid. Does it heal on its own over time? And if I want to have a baby, is there any risk for him? Thank you and goodbye.
Wow, thank you for your testimony. The questions will be answered at the end of the program with our two specialists. The World Health Organization estimates that there are 6 to 7 million cases of chancroid each year. In 1950, there were 3.3 cases of chancroid per 100,000 inhabitants, but today, the rate of reported chancroid cases has decreased, reaching almost zero in recent years. So now, I think we need our other witness to answer this. So please welcome Josue Gonzalez. Please tell us about your case.
Hey, man, how you doing? Thanks for the invitation, by the way. Well, in my case, I feel start to feel pain on my genitals, followed by the apparition of a colorist ulcer. So, that's when I was sent to this center in Chicago, and I was like, man, if I'm here, that's a serious business, bro. Whatever. Then they give me a canteen, something like that. And unfortunately for me, I was told that I had syphilis too, bro. I had syphilis too. I guess it's part of the work, you know what I mean? But that not end here. They also found some dude they call Edge to Crayon smears. The bad news isn't over yet, I guess. Whatever. They conclude that my chakra lesions were also infected with that dude, H2Cray. So my treatment was different because I have to be under intense fever chemotherapy within 3 days, bro. 3 days. Definitely, I not recommend it, bro. Use condom, please. So thank Christ I recovered. So I investigate some things and I have two questions too. So, the first one, what is the importance of distinguish between syphilis and chancroid related with that dude, H. Ducray? So, and also, how they didn't confuse syphilis with lymphogranuloma venereum. That's it, man. Answer me if you can.
Wow, man, that should have been really hard. Thanks for your participation and your great attitude after all. And now, let's welcome our first specialist that will talk to you a bit about the bacteria and help us answer some of the corresponding questions. And then move on to the second specialist who will talk to you about the disease, the diagnosis, and answer the remaining questions.
Hi, my name is Alejandro, and thank you all for inviting me. For me, it's a pleasure to be here, and I will tell you about the symptoms and signs of cancroid. First, after this incubation period of 3 to 7 days, some small painful papules appears on the genitals, which can rupture from superficial, soft, and painful users with irregular age. Occasionally, these deeper erosions can cause significant tissue destructions. The lymph nodes from a bulbo sometimes adhere to each other, suppurating and forming abscess. The infection can spread to another areas of the skin and generate new lesions. With this above mentioned, if genital ulcers or buboes without no cause are suspected, the first things to do is a clinical evaluation like a PCR. The PCR is a polymerase chain reaction test, and this testing may be necessary. Whenever possible, a sample of pus from a bubo or exudate from the ulcer age should be obtained and sent to the laboratory, and in the laboratory they can identify the H. duclei. Serological tests for syphilis and HIV and other herpes culture should also be observed to exclude other causes of genital ulcers. Answering the first question of Jasmine Holland, and can a person have a relapse? And yes, that's correct. Relapse can occur if the treatment prescribed by the doctor is not full complete. And another cause if is the antibiotic regimen is ineffective against the specific stain, or if the person is exposed to the bacteria again. The other question of Jasmine was, do condoms complete protects against cancroid? That's incorrect because condom specifically reduce the risk of transmission, but they don't offer 100% protections because um, cancroid source can appear on other areas of the skins not covered by the condom. Jasmine also asked if she want to have a baby, there is any risk to him, and this is a very important concern because the good news is that Haemophilus duclei itself is not known that they can cause a congenital infection in the same ways as syphilis or HIV can. The main risk to a pregnancy will be if he has a if the mother have a active or untreated infection during the delivery, which could potentially expose the newborn during the birth. However, with a properly diagnostic and treated infections had been cured, as in your case, Jasmine, there should be no outgoing risk for the future baby. So you can have a baby without problem. And for my part, this is all. Thank you.
Thank you for the opportunity to be on this day of death special. The cases talked about were very interesting. Now, I would like to start answering the question, does it heal on its own over time? The answer is no. Chancroid can handle its own without proper antibiotic treatment. The infection can persist, the sores can enlarge and become more painful, and even leads to the formation of large ulcers. Let's move on to another case of Josue Gonzalez. He talked about Haemophilus ducreyi. Talk about this, give me goosebumps. Well, let's see. This gram-negative bacterium, best known as the cause of chancroid, a sexually transmitted disease. The infection typically causes painful genital ulcers and may be accompanied by inguinal lymphadenitis. In men, lesions often appear on the prepuce and coronal sulcus, in women on the labia minora and freshette. Question is how they didn't confuse syphilis with lymphogranuloma venereum. Well, in my experience, the early serological test for LGP could cross-react with syphilis, leading to false positives. Improved anti-agent preparation and molecular methods reduce this issue. Another way is the molecular diagnosis like PCR assays and can now at the same time detect Trypanosoma pallidum, Haemophilus ducreyi, and trachomatis. Chlamydia trachomatis, allowing for accurate differentiation even in cases with overlapping symptoms. To finish my participation in this podcast, I would like to mention some new alternative treatments for chancroid. The first is macrolides, azithromycin and erythromycin. Offering an oral azithromycin is as effective as an intramuscular ceftriaxone for chancroid. Offering a convenient alternative to longer erythromycin regimens and other antibiotics. However, evidence quality is low and more research is needed, especially for HIV positive patients. Then we have two different antibiotics, ceftriaxone and with a single dose intramuscular remains high effective even in multi-drug resistance cases, and amoxicillin with clavulanic acid. This combination is effective against beta-lactam producing Haemophilus ducreyi, overcoming resistance to amoxicillin alone.
Well, it's nice to hear that these cases were successfully healed. And as always, it is interesting to listen to new cases and new information about Bacterious. So thank you to every guest for your time. And if you want to learn about another disease or bacteria, or if you want to share us your story, please write to us via DM. We are Bacterious Talks, and have a nice day of the deaths. Bye.